We don't know when the coronavirus will peak in our hospitals, but they're getting ready. Our Chief Medical Officer said today we could triple our ICU capacity. So how will that work? A short time ago, I spoke with Dr. Tim Southwood, one of the frontline specialists working inside a new purpose-built COVID-19 ICU at Sydney's Royal Prince Alfred Hospital. Tim, thank you for your time. I believe you have 16 beds in that unit. It opened 5 days ago and already you have 9 patients. How are you going to cope when we hit the peak?
Tracy, you're absolutely right. The unit that's just behind me now was only opened a matter of days ago, and it only took a matter of days to construct. And as you pointed out, yes, we've already seen some demand for the space, the new space that we've created in such a short period of time. How are we going to meet that wave? We're already preparing for that. It's an incredible team effort. There's been individuals and teams of individuals who've made a great deal of sacrifice with their time, working throughout the day and the night. And we're talking at every level in our hospital, from the administration down to the cleaning staff, across the way from nursing, medical staff, our biomedical support staff. It's just been an incredible effort to get not only the physical space done, builders in, but also the space fitted out so that we can actually help people in there. We need ventilators, we need dialysis machines, we need monitors so that we can look at how much oxygen in people's blood all the time. And so all that sort of infrastructure has been put in such a short period of time. And it's only through an incredibly close and dedicated and focused collaboration that's been going on, really for about the last month and a half to 2 months, I have to say, that we were as prepared as we can be currently.
When do you expect the peak will be?
It really is hard to predict that. What we can say is that we'll be as ready as possible. What we want to be able to see is that the wave doesn't overtop us, doesn't overwhelm us as we've seen in other countries. Exactly when that will be, we're not sure. We are grateful for every day that we have where the demand isn't rising, because it means we can continue to prepare and be ready for whatever lies ahead.
You're obviously prepared. The Prime Minister told us today that he was impressed with how Australians were responding to the social restriction measures. But have we done enough? Are we shut down enough, do you think?
I think individuals are doing their best. Groups of individuals, teams in hospitals are doing their very best. And I'm acutely aware of the impact that this new idea of social distancing is having. I get to leave my house every day and come to work, but my family stay there, and there's been significant changes for them. So when you ask a nation of people to make such a significant change in a short period of time, there will be a variable response. But I suppose what we hope is that Australians continue to take seriously the guidance, the recommendations that are coming through, because what that will help us do is continue to help Australians, help us help you. What you're doing, what Australians are doing will translate, we hope, into a decreased demand when that peak hits, so that we can continue to help people and we won't be overwhelmed.
The government, I mean, I understand you're not a politician, and I don't expect you to answer this like a politician. You're a doctor. The government is juggling economic impacts of this virus and medical impacts, health impacts. You only have to focus on health impacts. Do you think the economic impacts are simply not as important? You know what's coming.
I am aware that there is a heavy economic impact on the country. My feeling is that what we're asking people to do, what is being asked of people, is hopefully a short-term thing. This virus, this COVID-19 will come and it will go. We're not sure how long it will last, and I suppose it's always a trade-off between this personal sacrifice or national sacrifice we're being asked to make and people surviving this, people actually living through this. What we know is if people are able to bear that impact, we will hopefully see that less people will need to come to hospital, and we'll see less people die as a result of that.
Speaking of surviving this, medical staff like you will be our saviours. Are you well enough protected? Because we have heard constantly about shortages of protective gear, masks and gloves and gowns. Are you well enough protected?
Right now, yes. We have adequate personal protective equipment, and just today there's been assurances that from a New South Wales health perspective that people are taking that seriously, and people want people to be safe at work. We want ourselves to be safe at work. We don't want to catch this COVID ourselves, and we don't want to spread it ourselves. I would hope that people continue to do their very best to make sure that staff in hospitals are adequately protected whilst we try and help people.
Tim, are you afraid, and are your colleagues afraid of what's about to happen?
Afraid's an interesting word. I think we're aware, we're worried, but all we can do with those two feelings is, I suppose, harness them and continue doing our very, very best to make sure that when the wave does come, and it will come, that we are together ready to stand and continue to help people. I am worried about certain things, but there's being worried about them, and there's being realistic about what we can still do to try and change the tide, try and reduce this wave, try and meet the demand.
We've heard horror stories about doctors in countries like Italy and Spain having to choose who gets a ventilator and who dies. This is a dreadful question, but how are you going to manage that there? How are those decisions going to be made there?
We are heartbroken to see that countries, Italy, China, now America, are being forced to rationalise resources, share resources between patients where that would never have happened before. We have a system that is currently in place that every single day tries to give people the best chance to survive. What I can say is that even when we can't fix a person, we can always help a person. And I think that's always going to be the focus throughout this. And I need people to know that no matter what, no matter how short we become with resources, we can still help, but we can't always fix people in these sorts of crises.
I wouldn't imagine that you would want that decision to fall, that burden to fall on just one person in a shift. Is that going to be a collaborative decision?
We always collaborate amongst ourselves as professionals. So we already have a system in place that we use every single day. The reality is that, and we don't want to face this, but we think we will, we've seen this in other countries and we're prepared that this might be the case. We might not be able to meet that best scenario for a person with what resources remain. How we then apportion what is available with the need, that could be incredibly challenging. And everything that's going on in the community at the moment is allowing us more time away from such difficult decisions. But rest assured that these are discussions we're having with our colleagues throughout the hospital system, and there are approaches that we're developing that will help us make those really difficult decisions with the people around us that need our help.
Well, we wish you all strength in the coming days and weeks and probably months, and please know that I think the entire country is behind me when I say to you how grateful we are to you and your colleagues.
Thank you very much, Tracy.
Dr. Tim Southwood there.